Hi, I'm contestant number 8888, and I will now demonstrate the proper sterile setup and maintenance of a sterile field for a suture removal procedure. All supplies have been verified as sterile, sealed, and within their expiration dates. I will begin with hand hygiene. According to the Center of Disease Control and Prevention, proper hand hygiene is the single most effective way to prevent the spread of infection in healthcare setting. The CDC recommends performing hand hygiene before and after all patient contact and before donning sterile gloves to reduce the transmission of microorganisms. I will now open my sterile field using proper sterile techniques. I will place a drape on a clean, dry surface at waist level. I will open the package away from my body. I have a 1-inch border that I can touch. I will take the corner of the drape and lift it up, making sure it doesn't touch the table. And I will only touch the corners because, again, I only have 1 inch. I will place it on top of the stand, making sure I don't cross my fingers and making sure I work above my waist level. I will now arrange my sterile supply on the sterile field. I will start with 2 sterile gauze pads, again away from my body, and making sure I drop the item 6 inches above the drape. I will now continue with the sterilized forceps. I am maintaining the sterile field by keeping it within my line of sight, keeping my hands above waist level, and ensuring the only sterile items touch the sterile field. If any sterile item were to come into contact with a non-sterile surface, it would be considered contaminated and immediately removed from the field to maintain patient safety. I am now donning sterile gloves using proper technique. Once sterile gloves are applied, I will only touch sterile items. I can now assist my provider in a suture removal procedure.